encouraging adherence should be a top priority in CML. Missing as few as 3 tablets per month can have a huge impact on treatment outcomes with imatinib. One study showed that for patients who miss 3 or more tablets per month, the probability of achieving MMR over 6 years was only 14%. For patients who were more adherent, taking more than 90% of their prescribed medication, the probability was 94%. So, is adherence that much of a problem in CML? Let's take a look at the Adagio study that included 169 patients with Philadelphia-positive chronic phase CML who received imatinib for an average of 4 years. Adherence was evaluated over 90 days in this study. When surveyed, physicians believed that on average, 93% of patients were adherent to imatinib treatment in the first month after diagnosis, and that 87% of patients were adherent after 1 year of imatinib treatment. So, let's see what the actual figures reflect. A total of 67% of patients were considered to be adherent to therapy at 90 days, with only 14% of these being 100% adherent to their prescribed imatinib dose. That leaves approximately 1/3 of patients who were considered to be non-adherent. CML is a complex disease with many different outcome measures. A diagnosed patient may undergo repeated and regular blood tests and bone marrow examinations to evaluate hematologic, cytogenetic, and molecular responses that indicate suboptimal or optimal response to treatment. Additionally, in order to provide patients with the most effective treatment at given times, we need to consider potential kinase domain mutations, patient comorbidities, concomitant medications, and risk level using the Hasford or Sokal score. But it is really important that we don't get lost in all these analyses and always keep the patient at the center of what we do.